Good afternoon. It's 3:30. Calling to order the Thurston County Board of Health meeting for Tuesday, March 10th, 2020. I'm the chair of the Board of Health, Ty Menser. To my left is Commissioner Gary Edwards. To my right is Commissioner John Hutchings, who I believe is vice chair. Is that right?
Okay, then yes, I am.
And then we have Sarah?
Stacy,
sorry.
Clerk of the Board of Health.
Yes, no, I'm going to get that. We have Director Shelley Slaughter of Public Health Social Services and Romero Chavez, County Manager, to the far right. Okay, first item would be to call the meeting to order and approval of today's agenda.
Mr. Chair, I move to approve today's agenda.
Second.
That's for Gary.
Okay, have a motion and second. Approval of today's agenda. All in favor, say aye.
Aye.
Aye. Okay, agenda is approved. Second item, proclamations and presentations. We have two items here that are related, starting with a proclamation on Developmental Disabilities Awareness Month. And
Do we have somebody coming up?
Mark Moffitt will take the lead on that. Thanks, Mark.
Good afternoon, Commissioners.
Good afternoon.
I'm Mark Moffitt with, I'm the Social Services Manager for Thurston County Public Health and Social Services, and it's my pleasure to be here today to celebrate Developmental Disabilities Awareness Month with you. Washington State is the most innovative in the nation when it comes to developmental disability topics. From residential, self-advocacy, employment, we continually lead our community, or we continually lead in making our communities an inclusive environment. When President Reagan first declared March as National Developmental Disabilities Month in 1987, it was really about awareness. What is developmental disabilities? Who are they? Where are they? 33 years later, we've gone from awareness to visibility to inclusion. It's the inclusion in our education system, in our recreation, in our social gathering, and definitely the inclusion in our employment that make a complete community. I'll have to brag a little bit about Thurston County because Thurston County has one of the highest employment rates in the state. We're sitting at about 73% for people with developmental disabilities, which is much higher than even the average. And those jobs are in manufacturing, in IT, in restaurants, in guest services. It's all aspects. It's in the private sector, in the public sector. I would say one thing, though. I think we need more supported employment here at Thurston County government, but we can talk about that at a later date, hopefully. But let's talk about that 73% employment rate. It sounds great, but conversely, it's 27% unemployment rate for this demographic, which is unacceptable in any demographic. So how are we going to get to a lower unemployment rate? Here in Thurston County, we're working on some innovative programs, and I just want to talk to you about three of them. The first one is transportation. We have a very rural county in some aspects, and transportation is difficult. It becomes a barrier to employment for someone with a disability trying to get to the bus line or trying to get transportation to their job. So what we did at Thurston County was to bring in a transportation. It's personal. They come to the participant's house, they take them to work, and they take them back home. So this is eliminating some of the barriers to employment. Number two, high school transition. So our high school transition program helps students with developmental disabilities in high school in their final year of high school and gets them ready to be employed. So what we do is we work with them on soft skills, we work with them on schedules, we work with them on even the hard skills, taking them on job tours, finding out what they want to do with their lives. So that's the final year of high school. But what we're doing in Thurston County is we're one of 7 counties in the state that are piloting a program. It's called Job Foundation Value-Based Purchasing, or Value-Based Payments, excuse me. And so what this is going to do is allow us to work with students 2 years from graduation in anticipation of getting a job before they graduate, because they've gone to school all these years, every day, they're at school all day, and then all of a sudden school ends and they have nothing. So what we want to do is really get them that job before they get out of high school. So that's the goal. And then the third thing is tech. So we're working with Developmental Disabilities Administration and Division of Vocational Rehab to work on technology, bringing technology to the participants and also to the work sites to ensure that those barriers are met with as well, to help the employer and the participant communicate better. And then also, on that front line, we have 5 agencies in the county. We have a Morningside, Exceptional Foresters, Career Quest, Vadis, and Centerforce that help find jobs for our folks with developmental disabilities here in this county. And today I have somebody from Morningside. Morningside's been in our community since 1963, helping people with developmental disabilities find employment and other aspects of their lives. And it's my pleasure today to introduce to you the CEO of Morningside, Jonathan Bleeger.
Good afternoon, Commissioners.
Hello, Jonathan.
Welcome.
Thank you. Thank you for having me, and thank you, Mark, for the introduction. Mark really laid it out well for me. You know, Morningside has evolved along with the county over those 57 years, and we've been at the forefront of those changes in Washington State and leading the way in supported employment for people with disabilities, developmental disabilities specifically. And we've had some of the best outcomes, and I think that's really speaks because of our good partnerships and good relationships we've had with the county here, Thurston County, but also Developmental Disability Administration, and then very importantly, the businesses in the community. Those businesses are the companies that hire people and give them a chance to work, but more importantly, it's an opportunity for them as a business to grow and to succeed because they have a great employee that's really reliable, dependable, and wants to be at work. So it's really a win-win. That's our tagline, actually. Everybody works, everybody wins, because we really see the benefit of that. And it's allowing opportunities for individuals with developmental disabilities to be included in the community, contributing members, you know, they're earning wages and then contributing those dollars back into the economy. So it's just a win-win all around. And we're really grateful for the partnership and glad for the work that we have supporting those individuals. Just a couple high-level numbers here for you. Morningside this last year in 2019 in Thurston County alone supported 611 individuals with varying disabilities and placed 91 people into new jobs this last year. So really great numbers and some of the best across the state, if I may brag for a moment. But we're very proud of that and really happy to be supporting these individuals. And then overall, we supported 201 people into new jobs throughout the 6 counties that we serve. But Thurston County is our biggest, and it's our headquarters and where we were born in 1963. So thank you again for this proclamation. Thank you again for your continuing support. As Mark said, we'd love to have more jobs everywhere, you know, all sectors of the community. Supported employment in county government would be great too. We've done a lot of great jobs in state agencies over the years, so we can talk more on that in the future. But thank you very much for your support of people with disabilities. Thank you.
Don't leave, Jonathan. Just there may be questions from the board or comments, commissioners.
No, thank you for what you do every day. You're helping a group of individuals that I believe really appreciate it, and you might not hear that often enough, but good work.
Great, thank you.
And I'm glad, Jonathan, that you're, and Mark, you're going to work towards that 27% unemployment to get that down. I've worked with Morningside over the decades with the Olympia Police Department, because the city of Olympia hired some of your folks as well and put them to work. They're wonderful people. And I've toured your offices, and I was given a tour, I think last year or the year before, of state offices, and met with one of the employees at the state. Mm-hmm. And that was very rewarding. It meant a lot to her, and it meant a lot to me too. So the work you're doing is incredible. And I didn't know this. I mean, I'm glad we're doing so much in the capital county, Thurston County. Of course, we're going to lead the way in many areas. But I didn't learn this until Sunday, I believe. I saw it on a program that there was a disabled person, and there's other disabled folks that they have a guardian or they become a ward of the state, and they lose their voting rights. And I didn't know that was a thing. So I don't know if that's a thing in this state. I don't know where that happened. But the person that they interviewed, severely handicapped and in a chair and such, very able-minded and such, and was involved in politics. And he was awarded his right to vote back. And I thought it was very rewarding, but I didn't know if that was a thing in Washington State.
Yeah, I'd have to check into that. I'm not positive for sure, but I know we have a lot of people that we support that are self-advocates and want their voice to be heard and advocate for their rights and speak on the Hill every year. So
and this was a father advocating for his son, became the guardian, but didn't realize till later that by doing that, his son lost his voting rights. And
I see.
boy, it was very upsetting to the family. Anyway, cool story. Very cool story.
Thank you.
Thank you, sir.
Yes, well, thank you, Jonathan, for being here to support this declaration and giving us an overview of your organization. And at this point, do we have a proclamation to read?
Developmental Disabilities Awareness Month. Whereas Thurston County Public Health and Social Services is involved in advocating for programs that promote positive system changes, allows persons with developmental disabilities to achieve optimum independence, and promote innovative programs and practices that improve the quality of life for people with disabilities. And whereas Thurston County encourages all citizens to actively participate in events that appropriately recognize and celebrate Washington's diverse population, including persons with developmental disabilities. And whereas in Washington, approximately 83,000 adults and children have developmental disabilities, and a majority of these individuals are primarily or solely supported throughout their lifespan by their families. And whereas people with developmental disabilities share with all Washingtonians the desire to achieve personal success through education, meaningful work, and family and community ties. And whereas Thurston County is committed to recognizing that every person, regardless of perceived ability, has valuable strengths, infinite capacity to learn and make decisions, and the capability to make important contributions to their communities if given opportunities to do so. Whereas it is necessary that local communities in Washington, such as Thurston County, support the mission and purpose of Developmental Disabilities Awareness Month and encourage their citizens to recognize and respect this important commemoration. And whereas we acknowledge Washington State's leadership in public policy accomplishments concerning persons with disabilities in employment and their quality of life, and in identifying the improvements to public policy that facilitate full inclusion of Washington's citizens and developmental disabilities and their families. And whereas Washington State leads the nation with 87% of individuals with developmental disabilities in county-managed employment and day services participating in integrated employment compared to 24% nationally. Now, therefore, be it resolved, the Thurston County Board of Health hereby proclaims March as Developmental Disabilities Awareness Month in Thurston County and calls upon all citizens, communities, state agencies, and elected leaders to increase public awareness of the needs and potentials of individuals with developmental disabilities and to recognize that persons with developmental disabilities are vital and vibrant members of our communities. Adopted this 10th day of March, 2020, signed by your Board of Health.
Great. Thank you very much.
You're very
Thank you.
There you go.
All right, can we get a photo with you guys?
Ready for me now? Keep going? Okay, so again, I'm Mark Moffitt, the Social Services Manager for Thurston County Public Health and Social Services. I've got a lot to go over because we have a huge program, and it's nothing that I can do in 10 minutes, but I'm going to do my best for you. If you have any questions, please stop me or wait till the end. So social services encompasses three main programs. So we have Developmental Disabilities program, which is our largest one. We have a Specialized Recreation program, and then we also have Veterans program. And we'll talk about those individually. So what is our developmental disabilities program? So the major aspect of it is what we just talked about, and that's supported employment. Supported employment, we have 5 agencies in the county that support this mission: Morningside, EFI, CareerQuest, Vadis, and Centerforce. And what they do, the basic premise is the same. They have a job developer and a job coach. Job developer learns about that participant, what they want to do, what are their goals, what are their aspirations. And then they'll go out into the community and find a match. So they'll find an employer that needs a certain skill set, and then they'll match it with that participant, and everybody's happy. That's the way it typically happens. Then you have a job coach that comes in and does discovery, finding out what that client really wants to do, maybe take them on job tours, take them out to the community. Maybe they want to work in a restaurant, and they go out into a restaurant and they realize, no, I don't want to do that. This is awful. This is an awful job. I don't want this. Let's try something else. And so that's part of the discovery aspect of job coaching. And then also there's the soft skills, showing up on time. How do you greet people when you're at work? All those things that that Morningside and our other agencies are working with all these folks with, that we just take for granted most of the time. And then also they'll teach them the skills of the job. They'll do skill development, and then once they have a job, they'll teach them how to communicate with their employer, to do the job, and then hopefully they fade out because there's natural supports on site. The natural supports are people who are already employed there that the participant might feel comfortable going to if they have a question. So the whole idea is to have that job coach fade out, and it's just a job like the rest of us all go to. So that's what supportive employment is. And so we have over 425 participants in seeking or that have employment in the county. Community inclusion, what that's meant for are people that are 62 or above. It can be younger with a waiver, but 62 or above, they're done working, but they still want to participate in the community. And they want to go out. They want to go out and to go play bingo, or they want to go to the senior center. But they don't know how to do it. So we have community inclusion, which all of our supported employment agencies, they participate in as well. And they have a job coach. They have goals they have to set every 6 months. They go over those goals, and are those goals being met? If they're not, why? And so we get them out because we don't want people just sitting at home and not participating in our community. And so that's what the community inclusion is about. Then our high school transition, we talked a little bit about that. It's about working with students before they get out of high school to get them employed, because we don't want them sitting at home after high school, and then they get used to it. We want them to be, or we want them to have their goals, but we also want them to be active participants in their own life. And so one big component of that is to have, to bring in an income. And that shows a lot of pride. And I'm sure Jonathan can attest that when some of our clients, their first paycheck, they're so proud, they want to take a picture of with that paycheck. And that's really a rewarding experience for the job coach and for the job developer. And then we have a lot of community supports and services that we do. That these are things that support employment, and that can be self-advocacy. It's really important because I'm up here advocating for people with disabilities. Okay, great. I don't necessarily have a disability, but why aren't they supporting themselves or self-advocating for themselves? So we support that as well. We have programs in our county that let them come out or facilitate them to come out and talk about their own experiences. And I think it's more rewarding than me sitting here talking to you. And so we have a lot of things that fall under that. And then also our program supports not only Thurston, but Mason County as well. So we have an active community in Mason County doing the same type of things that we do in Thurston. Our funding comes through most of our funding comes through the State Developmental Disabilities Administration, and then we also get some funds from the Division of Vocational Rehab, and then we also have some county millage funds that we support, that support our program a lot. So I know we throw out a lot of numbers that may not match, but it depends on how we're looking at them. So we serve nearly 500 clients. Again, 73% are employed in this county. We have that value-based payment that we talked about earlier, where we're going to work with high school transition a year earlier to try to get them ready to have a job once they complete high school. And then we're working on a crisis bed partnership with South Sound Behavior Hospital. What that would do is, so there are crisis beds in the county for mental health crisis, but not for a dual diagnosis. So with developmental disability and a mental health issue, that actually creates an issue that some places aren't equipped to handle. And so we're working on that. In fact, my predecessor, Jennifer Popchak-Hakim, she's the one who initiated this, and we're trying to continue this on and get this partnership going. And then I want to brag about staff. So again, we had a successful audit this past year that ended in December, and I take no credit for that. That was all Jennifer Popchak-Hakim. She organized it. She left before it, but it was really her baby. And then also Annalisa Cole and Damian Howard, who just did a phenomenal job making sure that we had all the information that the state needed for that. So I just wanted to give them credit for that. So the other program that we do is specialized recreation, and that's really about just enjoying life. It's not about work. It's about going out and going bowling, playing bingo. We have swim clubs. We take them out of county to sporting events up in Tacoma, to the Glass Museum, the Car Museum. We have over 100 programs that we do each year through Special Rec. And this isn't just for people with developmental disabilities, this is for everyone. We want everyone to be involved in this so that it is more inclusive. In fact, this past Saturday, we had our St. Patrick's Day dance, and it was great. I was there. We had people from the community there. Everybody had a great time. We had snacks. We had a DJ playing some old tunes, and it was a lot of fun. So I will send you an invitation to the next one. Maybe you guys can come out and dance the night away. It would be great. So that's Special Rec. And our last major program is the Veterans Program. So under Veterans, we have the Veterans Assistance Program, and what we do there is we help indigent veterans with emergency financial assistance. So maybe they're short rent 1 month, or maybe they don't have the money for utilities because it was just too high that month. So what this program does is keep them in their home, and it keeps them warm in the cold weather. And then we look for reasons why that happened and try to case manage that. And that's all. Most of that's happening at the Lacey Veterans Service Hub. And so there's a lot of different aspects there. So not only financial assistance, but we have the ability to. We have volunteers there that help with VA disability claims, mental and substance abuse counseling, so many things, housing, employment, so much there. I encourage any veterans that are watching to come out and just come see what's there. We can probably help you with something. And then we also have Veterans Case Management. And so the Veterans Case Management helps veterans that are somehow involved in the Thurston County legal system, and they have a mental or substance use issue. We can help them navigate the system, get them treatment, and we can also help them out financially with certain aspects of that of the legal system, and maybe even get them into Veterans Court. So in the Veterans Program, we helped over 80 clients last year in total. And the big thing we did last year was we updated our policy. Thanks to the county commissioners, we were able to expand services and expand who we could help as far as veterans are concerned. So we raised the income level, and then we expand the services that we actually can pay for. So to make sure they can get to their job, stay in their home, and keep the heat on. So that was really instrumental last year. And then new initiatives. I'll just talk briefly about that. So for the past decade or so, the Veterans Program has been more reactive. A soldier or a veteran comes in, they can't pay a bill, we'll help them out financially. What we're trying to do now is be more proactive and look for those veterans that are underemployed or unemployed and on the verge of losing their home, and then kind of do what we do with developmental disabilities and embrace them with supported employment with a job developer and a job coach, and get them the type of employment that will keep them in their home and financially stable. That's more to come on that. That's just throwing it out there for now. And just the highlights. So we contract with 14 agencies. We work with over 20 high schools. The recreation program, like I said, over 100 events each year. And the Veterans Program is located at the Lacey Veterans Hub on 6th Ave in Lacey near Fred Meyer. And please come out and just see what we have out there. That's all I have, gentlemen.
Questions for Mark?
I just want to compliment you on your enthusiasm. Thank you very much, Mark.
Thank you. Appreciate it.
It does show.
Yes.
And I so appreciate you and not only what you've done, but what you're doing as well. Thank you very much, Mark. You're a good egg.
Thanks, sir.
Mark, my understanding of the changes we made last year is we were trying to match our eligibility with kind of the resources that we had. And do you think we hit the mark in terms of the expansion we did and being able to allocate the available funds to the most, deserving veterans?
Oh, absolutely. Based on, if you recall, the housing in this county alone is really high, and what we were paying before wasn't even able to cover a month's rent.
Right.
So expanding the amount we could pay a veteran, and then also raising that income level to above the poverty level the way we did,
Yeah.
it was just fantastic. We can help so many more people. In fact, I've been keeping track of it, and I'll have to give you data for that so you can see where we couldn't help last year, but now we're able to. I'll get you that data.
Perfect.
Yep.
When you're done. I see you partner with over 20 high schools. Are we in the colleges at all?
We are not in colleges for supported employment, but we do have, is Job Club still in? So we work with the college, I think South Puget Sound Community College, we have a Job Club there for participants.
Okay. And because you work with veterans, the Modern Warrior Live videos now on TCM.
I've been waiting so long for that.
I heard it this morning. It's out.
All right, great, fantastic.
Speaking of Thurston connections, I did a specialized recreation episode last summer.
I didn't see that one.
So if you're interested in some of the stuff Mark's talking about, there is a connections episode out there.
Oh, great,
We did it at Kennydale Park with Dylan Keel.
Oh, nice.
great.
And where was the dance held at?
Unified or United Churches, right on Capitol, right kitty corner from the Capitol.
Yeah.
I think it's Unified.
Oh,
United,
11th,
thank you.
Capitol on the 11th?
Yes, yes. Yeah, it's a nice purple floor and lights around. It was just great. We hold them all there right now.
Used to be a voting center where you can go in and vote and get your little sticker.
We're doing that downstairs,
years.
though, aren't we? Yeah.
Okay, thank you, Mark.
All right, thank you.
Thank you.
Next is item 3, opportunity for the public to address the Board of Health. I haven't been provided any signups. No? Okay,
God, you're lucky.
very good. That brings us to Health Officer's Report, item 4. I'm going to turn to Shelley Slaughter, Director of Public Health and Social Services.
Good afternoon, Commissioners. Thank you very much. I'm Shelley Slaughter, Administrator of your Board of Health and Director of Thurston County Public Health and Social Services. I'm providing this report on behalf of our acting health officers in Thurston County. I'm going to spend the bulk of my time today both on this item and the next item, which is Health Officer's Report, followed by Department Director's Report, to talk about COVID-19. I'm going to provide a situation update to you as of 8 p.m. today on Tuesday, March 10th. Information on COVID-19 is rapidly changing, and we receive updates virtually every hour, as well as new guidance from our national and state partners. So as of this moment, we have 113,702 cases across the globe of COVID-19, 4,125 new since yesterday. In the United States, we have 472 confirmed cases. In Washington State, which is the epicenter of the U.S. outbreak of COVID-19, as of now, 267 confirmed cases, and unfortunately, 24 deaths. Primarily, those deaths have been in King County. Positive cases have been identified in Clark County, Grant County, Jefferson County, Kittitas County, Skagit County, King County, Pierce County, and Snohomish County. As of this moment, we have no Thurston County positive cases originating in our community. However, the current risk of COVID-19 in Washington State is alarming and is increasing. Public health is identifying more positive cases of the disease in the state virtually every hour, and these new cases suggest that the disease is spreading further in the community. As we test more people, we also expect to find more positive cases. And I'm going to share a little bit with you about testing. Many people have been interested in testing. But before I go into that, I want to share with those viewers who may be watching us today, and again with you as the Board of Health, a little bit more about what exactly is COVID-19. So COVID-19, also known as novel coronavirus 2019, is one of 7 strains of coronaviruses that we know about. This COVID-19 strain is a new virus that we began to see developing in China in late December, and we became aware of it and activated our incident command in Thurston County approximately 1 month ago. This originally started in China and then began to spread elsewhere throughout the world and into the US and Washington. This is a great concern to us because this particular strain, called COVID-19, is one that we have not seen before in humans, and we do not have vaccines or treatment for this. There are 4 other common strains of coronavirus that cause common cold symptoms, and that occurs in our general population. That's different than this COVID-19. So many people wonder, how does COVID-19 spread? We're still learning a lot about this new disease. Research is ongoing, but what we do believe is that COVID-19 is spread via respiratory droplets produced when an infected person coughs or sneezes, and then it enters the eyes, nose, or mouth. People that are within 6 feet distance can be exposed to those droplets. It can also be found on surfaces that people touch, and then they touch their face, eyes, nose, and mouth. How severe is this illness is something that we have been learning a lot more about, especially as the alarming number of deaths happen in Washington state. For the majority of people infected with COVID-19, the symptoms are mild to moderate respiratory symptoms, similar to a cold or flu. But for certain high-risk populations, we're seeing increased hospitalization, more severe illness, pneumonia developing, and death. The high-risk populations that we're seeing COVID affect the most, that we're deeply concerned about, are people over age 60 years old, people who have underlying chronic health conditions such as heart disease, lung disease, kidney disease, diabetes, cancer, and those types of chronic illnesses. Also, people at risk include those with autoimmune disorders and pregnant women. So what are the symptoms of COVID-19? One of the things that is really tricky about this is it is very similar to flu symptoms, and flu is still prevalent in our community. One thing that we continue to advise everyone is to please get a flu shot to protect yourself from flu. That can also help healthcare providers help to rule out flu as one of the symptoms that's separate from COVID-19. So what are those symptoms? Fever, cough, and difficulty breathing are the primary hallmark symptoms of COVID-19. The difficulty breathing is caused by the infection going into the lower respiratory, which is different than upper respiratory, cold and cough. These symptoms may appear in as few as 2 days or as long as 14 days after exposure to the virus. That is why that's what we refer to as incubation period of approximately 14 days. So people who may be exposed to COVID-19 are asked to self-quarantine at home to see if they develop symptoms. People who are ill, who have been exposed, are told to isolate at home. And we encourage people who are experiencing these types of symptoms to please stay home. Please do not go straight to an urgent care or a hospital, but please call ahead to your healthcare provider. This is to help protect our really critical and valuable healthcare resources that we have and so that people can get the care that they need and we can prioritize those in the greatest need for those hospital resources. So how can we protect ourselves from COVID-19? The major things that we recommend are what we have been recommending for hundreds of years, which include washing hands. We cannot emphasize enough how important it is to have good hand hygiene, and that includes washing your hands with soap and water, or if soap and water is not available, a hand sanitizing product. For hand washing, we recommend more than 20 seconds to ensure that bacteria and viruses can be killed. Avoid touching your eyes, nose, or mouth, especially with unwashed hands. That can be really challenging because when we as humans touch our face many times a day. We also have social customs that we're really used to, such as handshaking and touch, and we encourage people to avoid that at this time. Cannot emphasize enough how important for anyone with any symptom of illness, please stay home and avoid close contact with others. Again, we believe that that 6-foot distance is a safe distance for people to ensure that they have a barrier to not be exposed to those droplets in the air. Those droplets don't live for very long on surfaces, but we also are encouraging people to take extra measures to increase their sanitation efforts, ensure they're wiping and sanitizing surfaces and doing extra cleaning of their home and workplace. Again, there are currently no vaccines or treatment to prevent novel coronavirus COVID-19. We are also concerned about what the mortality rate is. Right now, as we have more testing availability coming on board in the United States and in Washington State, we'll be able to detect more cases of COVID-19 and have a better sense of what the mortality rate is. What we know from other countries and from the research that has been done thus far, that the mortality rate is anywhere from 1% to 3%. Again, it tends to impact our vulnerable populations and at-risk people the most. So a lot of our efforts are focused on protecting that population. We ask that people exercise personal responsibility and be aware of what their own risk factors are, and for those that have close contact with those high-risk populations. And that can include things like making choices about where people go in the community. Any questions thus far for me?
I've got questions, but I
have
don't know
comments,
if I'm
but no
going to
questions.
disrupt you. How long are people sick when they are sick?
That really varies from person to person. We have seen people ill for approximately 6 weeks or so. This is one that can hang on for a long time. So again, we're still researching a lot about this to find out exactly how long it is before people are testing negative after they've had a positive result.
You mentioned 100,000 that have it, maybe worldwide or some figure like that. How many have had it and gotten over it? And there must be some in that 100,000, or all those people currently sick, or how many have gotten over it?
The vast majority of people recover perfectly well from COVID-19. But again, that 1% to 3% of people, particularly in those high-risk populations, we're not seeing that recovery. We're seeing mortality. We're seeing hospitalizations. So for the most part, people recover well. But this is really concerning because it's spreading rapidly in our state, and we want to get ahead of this and protect our community and not wait till we have positive cases before we start protecting those. And that's part of why Governor Inslee today, you may have seen, made some additional recommendations, particularly for long-term care facility guidance and to protect those high-risk populations where we're in Washington, we are seeing the majority of those fatalities at this point.
What are we doing about about, like jury trials and crowded conditions in the court and that type of thing. Are we going to do something about that? Has there been some guidance out on that yet?
So one of the things that we are considering at this point is to get ahead of this illness. We're trying to slow the spread. We're trying to mitigate it. At this point, we cannot contain COVID-19. And so we're looking at things that we refer to as social distancing and other non-pharmaceutical interventions that we can do to slow the spread. And that includes assessing things such as reducing crowded conditions where people are not able to get that 6-foot safe space. Considering meetings, asking people to consider things such as teleworking, avoiding crowded conditions, and we're also working to provide guidance to schools, businesses, to nonprofit organizations, to our shelter providers, to many others in the community, as well as our healthcare response providers, on things that they can do to reduce the spread of COVID-19 and encourage greater and more aggressive social distancing measures. The governor, the state health officer, the Board of Health, and our local health officer are all empowered to impose certain types of restrictions to prevent the spread of disease. And so those are all things that we're considering at this point, and we're providing consultation to people as we get those kind of questions. But again, in Thurston County right now, we don't have evidence of positive confirmed cases, vast community spread. But we do know that the severity of this illness has a huge impact, especially for our vulnerable populations. And we're trying to focus our efforts right now, especially on those, including in our community. As you know, we have a large number of people without housing that we are focused on that also don't have access to sanitation.
Just real quick, responding to Commissioner Edwards, I had a meeting this morning with the presiding judge who told two things that are responsive to your question. One is that locally, the judges have adopted a policy of being flexible about jury requests for waivers for jury service. If they're ill or they're in a risk population, they can make that be known to the court and potentially have their service extended. So that's good. And then they also told me what I hadn't heard before was that the Supreme Court Chief Justice had authorized local courts to waive rules of court that didn't have a constitutional dimension in appropriate circumstances that might relate to civil calendars. It's not going to solve the problems of the courts in general because the criminal process is so constitutional in nature. So that's going to be a very thorny problem if the situation continues to worsen. But there are a couple of tools in place that our local courts have so far.
Yes, that's great. And we are in contact with our local court or our Thurston County court administrators about that.
Commissioner Hutchings.
I've scratched those off my list because I had that conversation with presiding judge Rice this morning as well. And I've asked the health department to reach out to Pam Hartman-Beyer as well.
We have done
so. Thank you. I like what Mark Moffett said this morning and put it kind of in perspective. It's like you said earlier, Shelley, it's changing rapidly. It's changing every couple hours. And he said we have 75 years of research and experience with the flu, but only 75 days with this. And so it's going to be very flexible and fluctuating. I would just caution folks that when you hear people on the news, I was home at lunch, and you hear people on the news opining, these newscasters, they're not medically trained, they're not doctors, but they're opining on this and building up some hype. Just take it with a grain of salt because they're not medically trained. And then a news flash came out that New Rochelle, New Jersey, the National Guard has been activated because of the virus, COVID-19. But then after that news flash, then you see what they're doing is they're delivering food and water and supplies and and resources to feed people that have been quarantined. So it's not like they're standing on the freeway, keeping people out and keeping people in. They've been activated to help. They've done the state of emergency in New Jersey as well. So there's a lot of hype. Just listen to medically trained folks and take the advice that's here.
Thank you, sir. A few more things that I'd just like to add before I close this is we've had lots of questions about testing, and as many people may have heard, that our testing capacity in Washington State and the availability of testing has recently increased, and we're really grateful for the University of Washington, who came online to support our Washington State Public Health Lab to increase testing, and now private laboratories are able to have this capacity. Any healthcare provider may order a test for COVID-19 for someone that is experiencing symptoms, and also who has a known exposure or is a close contact of someone who has been confirmed with COVID. Right now, this is very new. This is very dynamic. COVID-19 is a notifiable condition, an immediately notifiable condition to the Public Health Department. So as we learn of any positive cases in Thurston County, we will immediately be sharing that information with the Board of Health, with the public. That information is available on our website and social media. We will also notify our local news media outlets. We recommend that people visit our Thurston County webpage. We're keeping that updated. There are links to the most recent information from the Center for Disease Control, from Washington State Department of Health. In addition, people can call the Washington State Department of Health that has established a call center to address questions from the public. And this phone number is 1-800-525-0127. And these phone lines are currently staffed from 6 a.m. to 10 p.m. 7 days a week. This is not a phone number for testing results. People need to work with their individual provider to get those testing results. Right now, also, testing is at highest priority as we increase our capability to test for this for healthcare workers, patients in public safety occupations, such as our first responders, patients involved in any kind of illness cluster in a facility or institution, such as a long-term care facility, like we've seen those majority of cases in King County. Patients, again, with lower respiratory illness that are hospitalized or that are fatal, those are prioritized for testing, and patients in those risk categories that we talked about, older than 60, patients with underlying medical conditions, pregnant women, and patients also with worsening symptoms. So this information changes very frequently, so we encourage people to talk to their healthcare provider, call that number at Washington State Department of Health. They also may call our health department and visit our website for more information specific to what they may be seeking. And finally, I just want to say a lot of gratitude and thanks for the partners that we've been working with, the Washington State Department of Health, as well as locally our Thurston County Emergency Management, our healthcare response partners, our hospitals, our healthcare providers. This is a really stressful situation for everybody to be in, and we're continuing at Thurston County Public Health and Social Services and throughout Thurston County to conduct business as normal. And I just really can't thank enough our staff who've been working very hard to prepare and plan for this and to prepare our community for COVID-19. And thank you also to the people out there that are really looking out for those that are most vulnerable in our community and supporting each other. So in times like this, it really comes down to our neighbors and our community in Thurston County supporting each other, and we will continue to provide timely and accurate information as we have it, and we will be working hard every day, every night to continue to protect our community against the spread of COVID-19.
One more
Yeah.
question. Have we figured out, or you figured out, at the point of contamination, if you will, that an individual becomes contaminated, at what point thereafter can that person contaminate others?
That's a really good question. It's one that we hear a lot. And again, we're still really learning a lot about how this virus is transmitted and how contagious it is. But we believe that this virus, COVID-19, is most contagious when people are symptomatic. So that is when they are coughing and producing those droplets, and that's how you are at most risk for contracting COVID-19. One other just thing that I want to share about that is many people have asked us about masks. At this time, we do have a shortage nationally and locally of masks, and the CDC and Washington State Department of Health and Thurston County Public Health and Social Services continues to encourage people to follow those other 5 measures that we recommend and to preserve the critical supplies that we have for those that are ill and for our first responders and healthcare workers.
No, that's it.
Shelley, I have one question, hopefully a quick one. When you mention the symptoms, fever, cough, and respiratory, does it also come with that, like when you normally have the flu, you sort of have that headache and fatigue? Does that come along with it too?
Yes.
Okay, I figured, but since you didn't say it, so it's hard to sometimes distinguish between flu and,
Yes.
in a sense, unless you
Yes.
have the respiratory issue.
Very, very similar symptoms.
Okay.
I think the real key on this one, when it seems to take a turn for the worse, is when it goes into the lower respiratory tract and people develop pneumonia and experience real difficulties breathing, burning sensation in the lungs, and really, for the most part, again, people can recover at home just fine. There's not a medical treatment that can help them, but for those that do develop those more severe respiratory symptoms, then it's supportive care that hospitals are able to provide to essentially support them in breathing.
Very good. Let's move to our first department item, which is the opioid response update. Katie Strozik leading that. Welcome, Katie.
Shorter than Marcus. I'm Katie Strozik. I'm the opioid response coordinator at Thurston County Public Health and Social Services. Thank you for having me today to update you guys on the work that the task force is doing and all of our partners in the community as well. So like Mark said earlier with his program, this is a lot to fit in 10-ish minutes, so I'll try to make it quick. Go ahead and stop me too if you have any questions in the middle of it. So some background information, the resolution declaring the opioid epidemic a public health crisis was passed in Thurston County in June 2018, and then the task force was convened at the same time. The official response plan was adopted about a year later in June 2019, and then the task force has continued to meet since that July 2018 date as well, on an every other month basis. As the task force has met, they've developed 6 areas of focus that were adopted into the response plan. Those 6 areas of focus were broken down into 25 strategies. The 25 strategies were then divided into 6 different work groups to move forward on kind of the more boots on the ground strategic planning portions. Those 6 work groups are addressing data, prevention, criminal justice, naloxone, pregnant and parenting women, and then access to treatment. The 6 work groups at the end of 2019 developed SMART objectives, which are going to be specific, measurable, attainable, realistic, and time-bound goals that they're looking to reach by the end of 2020. They decided on 33 different SMART objectives, with some of them already being accomplished. They're set periodically, so some were set to be achieved prior to 2020, And then some are set to be achieved during these first few months, and then a lot of them are set to be accomplished by December of 2020 as well. So in looking at the progress that's been made so far for the completed SMART goals, which is really exciting, considering that they were just finalized this past December, we've already achieved 6 for full completion. And then by the next task force meeting, we will be adding a couple more to that list as well and exceeding that 6. So the first one is going to be Goal 1, Strategy B, provide 1 training to dental care providers on opioid prescribing and the use of the prescription monitoring program. That was completed through a training provided by the Acora Foundation and Cascade Pacific Action Alliance. Dr. Teresa Madden hosted it. There were over 100 attendees present, which is really exciting. The dental sector has been someone who is historically kind of left out around opioid prescribing. So to have that many individuals in the room learning about opioids, prescribing practices, encouraging them to utilize the prescription monitoring program to monitor for their individuals that they're seeing is really exciting, and especially exciting to see at a local level as well. Goal 2, Strategy A, conducting a survey of local prescribers regarding attitudes and barriers to becoming waivered and prescribing medication-assisted treatment. So in the United States, you need a waiver, which is a specific training requirement in order to prescribe Suboxone or buprenorphine. A lot of areas in the treatment section of the plan look at expanding access to medication-assisted treatment, specifically Suboxone. So in looking at expanding treatment, we need to expand the number of prescribers that are available to offer that treatment. So in order to be able to expand providers, we need to know why people either aren't getting waivered to prescribe, or why they're not utilizing their waiver to prescribe, or why they're not increasing their patient base. So the treatment work group conducted a survey of a bunch of different local healthcare providers. It was modeled off of a survey that Providence did already, and asked them about their attitudes around medication-assisted treatment, the barriers that they were seeing, why they either are or are not waivered, and then what types of technical assistance they may want in order to either become waivered or utilize their waiver in the future. And then along with that waiver as well, there was a goal to host 3 buprenorphine or the waiver trainings at a local level, and 3 have been completed with almost 50 individuals attending and becoming waivered in the local Thurston County area and surrounding counties. So again, along with more medication-assisted treatment expansion, Goal 2, Strategy C, was looking to amend all treatment court policies and procedures to allow the use of all medications approved by the FDA for treatment of opioid use disorder. Historically, not all treatment courts have allowed medication-assisted treatment, so you couldn't be in drug court and on methadone or Suboxone, for instance. It was a violation of your drug court agreement, but that has since changed. So now in Thurston County, you're able to be a drug court participant or a family court participant and be on anything that's FDA approved to treat opioid use disorder, which is really exciting, and it is officially adopted into their written policies and procedures as well. And then that also kind of dovetails in with the jail medication-assisted treatment program that's looking at being developed too. So individuals can start their medication-assisted treatment and then have a continuation while they're looking at being a drug court participant. Goal 4, Strategy B, complete 1 report describing naloxone use in Thurston County. A lot of the goals around naloxone in the work plan look at either discovering where it's being used, expanding access, and then finding the gaps. So a report was completed by Dr. Mark Stern regarding the use by law enforcement over the past 2 years at a local level. He did it for all of the law enforcement agencies locally that carry naloxone. So you have the Thurston County Sheriff's Office, Olympia PD, Evergreen College, all of them. He detailed the number of times it's been used, successful reversals regarding naloxone, and then kind of some narratives around barriers in the program or how the program could be improved in the future, and then how law enforcement carrying naloxone fits into the broader community perspective too of reducing overdose fatalities. And then for Goal 5, Strategy A, obtain state approval of 1 strategic plan for a higher risk community in Thurston County. This is going to fit in with the prevention work that's going on in the plan. This is within the Community Prevention and Wellness Initiative for the state of Washington. These are going to be youth substance use prevention communities. So in Thurston County, we have Tumwater and then Tenino Bucota. This one was for Tumwater to be approved. They're primarily ran through community coalition work. So Tumwater has a coalition that's working together, both community members, Department of Health, local public health, in order to address youth substance use, preventing that, and then addressing all of the also adjacent items that go with addressing youth substance use. So more community involvement, parenting classes, and things of that nature. So then outside of the achieved SMART goals, the task force has been making a lot of progress too that aren't able to be marked off on a specific checkbox on the plan. There's been an increase in naloxone distribution. So Public Health and Social Services has begun distributing naloxone to businesses and soon to come schools who would like to be trained in naloxone administration and have it on site for use. The survey that was mentioned earlier that was conducted by the treatment work group actually formed into a bi-monthly medication-assisted treatment prescriber meeting group. So they meet every other month, and it's been over 24 prescribers each month from all different sectors, both criminal justice, primary care, hospitals, all meeting together to talk about prescribing medication-assisted treatment, the barriers they see, their clinic flows, and how they can work together more and kind of streamline processes and make it more successful in the community for individuals who need to access it. The task force has been working on prioritization of communication strategies and combating stigma. Stigma has been a big one that each of the work groups is really working hard on. There's been some barriers in looking at moving forward due to just community stigma. So trying to focus on education around the community and starting community conversations, hosting community education sessions and things of that nature to make sure that information is getting out about what resources are available, that factual information is getting out to make sure that myths are being busted and not continued to spread, so that we can get more community members on board with the work that's being done. The task force has received a bunch of positive media attention, which is really exciting. Media attention in general is exciting, but it's even better when it's all positive. So both the task force and task force partners and task force programs have been featured in avenues such as the Olympia Standard, the Olympian, and Thurston Talks as well over the last couple of months. And then with community support, each task force meeting, there's been multiple new members coming who have actually gone on to join the work groups as well, and then with different sectors and different sectors coming to the table now as well as seeing just community members who are not agency affiliated coming to the table, which is really exciting to see community members there on their own time who are not there to represent an agency or someone who's connected to a treatment provider or anything of that nature. As far as general community progress that isn't tied specifically into the strategic plan and response plan, there's been obtainment of new and increased funding for different strategies. That's been across the board. A lot of agencies in the community are independently looking at how they can increase their funding. I know there's been some partnerships done with University of Washington recently for research around pregnant and parenting women work, and then some other funding opportunities that are kind of in the works right now, which I'll touch on in another slide. There was the development of the Thurston Mason Recovery Coalition, so that's really exciting to have kind of a local chapter working on recovery work in Thurston County specifically that meets on a monthly basis rather than only having a state group that can be reached out to. There was an opioid use reduction and recovery employer forum that was held by the Safety Net Council and our alliance in order to reach out to employers to kind of encourage them and give them more tools to hire individuals who have opioid use disorder. And then Recovery Helpline's medication-assisted treatment online location finder has been launched. So finding medication-assisted treatment got easier with that because if you go to the Recovery Helpline online, there's actually a map that's interactive and you can search for what type of medication-assisted treatment you want or other types of treatment, and you can zoom in and see hours, where the clinic is, what's required to go there, whether they take you on a walk-in basis. It makes it a lot more accessible than having to Google a phone number and call each treatment provider down the list. And then looking at adding to the evidence base around treatment approaches. So the data work group is really working on finding where the data gaps are and what other research can be conducted, as well as Olympia Butte Clinic having received a research grant to look at peer involvement and engagement in a low barrier Butte Clinic model in order to hopefully further some evidence around peer involvement and get that client-centered data at the table. So some of the big upcoming projects that are being worked on right now, both Thurston County Prosecuting Attorney's Office and Public Health, as well as Olympia Police Department, applied to Healthcare Authority and the Washington State Association of Sheriffs and Police Chiefs for funding in order to start and expand law enforcement assisted diversion programs. That was supposed to be announced last week, but due to, coronavirus and all of that, it's been delayed, so hopefully that should be announced pretty soon as to whether either of those applications were funded. That fits into the plan and looking at kind of innovative strategies and how to divert individuals and come up with more creative solutions to serve them rather than looking at just incarceration. Medication-assisted treatment induction for individuals incarcerated in Thurston County Jail is being worked on. The jail is working super diligently with their healthcare system and with the Butte Clinic as well. They've started education sessions both for their correctional officers as well as for individuals who are incarcerated. They offer a taper right now, and they offer to also get you started on medication-assisted treatment prior to your transition outside, prior to your transition upon release, if you're looking to connect with a clinic to start upon release as well. And then looking at community education and engagement events. So like I mentioned earlier, the community education and stigma is a really big focus right now. The task force is going to work on Overdose Awareness Day on August 31st. So there will be a group working on planning that. That'll be at Heritage Park downtown. Event details to be determined on that one too as the group moves forward. Again, addressing the stigma around opioid use through what will be a community event ran through the treatment work group in summer. Event details on that one to be determined as well. They're still in the planning phases. Workplace and school overdose education and naloxone rescue kit distribution. Again, public health through treatment sales tax has acquired naloxone kits in order to be able to provide them on site to businesses. We've actually reached out to schools as well, and the ESD has been really great about approving that, and so that'll be moving forward in the next month or so in order to be able to provide education to nurses at schools and provide them with naloxone kits to have on site in case any of the students or staff or parents experience an overdose on campus. And then safe medication storage. There was new funding awarded and expanded funding through Public Health and Social Services in order to expand ways in which medication can be stored outside of just lock boxes, really looking at the continuum of options that need to be available for all age groups and all strategies that can be focused on there. I know that was a lot. Do you have any questions?
Well, you're busy. My goodness.
Commissioner, anything for Katie?
Oh, it is overwhelming, and I'm glad you're there.
It's a lot of information all at once.
No, but just thank you, Katie, for all that you're doing. It's incredible.
Thank you.
Katie, are there any SMART objectives where it's directly dependent on, county funding or increasing? I mean, just in terms of what we might want to look at as we approach our budget for this coming year, are there things that would directly need that in order to be successful? If you don't have that at the top of your head, I'm just throwing it out there. Let us know so that we can have that discussion at the right time.
There are not any SMART objectives that are completely make or break based on county funding opportunities, just because there are other funding opportunities at the local, regional, state, and federal level. However, those can be really time delayed to come across and really competitive to attain with some pretty restrictive both expenditure allowances, reporting requirements, and things like that. So the ability to utilize local funding, I think, really shows both local buy-in to programs that are being offered, as well as kind of expedites the timeline in which things are able to be completed on. So rather than looking at applying for a federal grant where you'll hear in 6 months, and then it'll take another 6 months to get a program operating, where you're going to need supplemental funding, being able to fund things at the local level can kind of get them rolling right away. So local funding is always needed in order to get things kickstarted, especially.
Okay, thank you, Katie.
Thank you.
Appreciate that.
Thank you.
All right. Thurston Thrives. I see Crosby Carter is in the house and Liz Davis, and we have an item where they're going to update us on the work of Thurston Thrives.
Good afternoon, Commissioners. I'm Liz Davis, Community Wellness Director at Thurston County Public Health and Social Services. As you know, Thurston Thrives is a public-private partnership that we've been a part of for a long time. It's exciting that next month, Thurston Thrives will be 6 years old. It doesn't seem like it's been that long, but the Thurston County Chamber Foundation has been an amazing partner throughout this entire endeavor, in addition to other community partners and various departments within the county, including you as commissioners. So I'm going to turn it over to Crosby to tell you all about what's happening lately.
Crosby, can I interrupt you just for a minute? But Katie, is that Kyle's mom? What? Is that Kyle's mom that's with you? No, okay. I just wanted to clarify something before. She is with the task force then. Okay, good enough. Sorry.
Well, hi.
Go ahead.
Thanks, Liz.
Pull that mic to you there.
Oh,
Okay, great.
hi. Hello. Thank you for having me here today. I'm Crosby Carter, the director of Thurston Thrives. I am newly back from maternity leave and still kind of getting my feet wet, catching back up with all the work that's happened over the last couple months. But I'm excited because a lot of what we're going to be focusing on from here and going forward is really looking at a deep dive into the structural needs of Thurston Thrives. Last year, the Coordinating Council undertook some work, surveys, workshops, a lot of interviews with team members about what does the initiative need, what will make it better, what will make it thrive, and how can we really increase the impact within the teams themselves. So I'll be picking back up on that work going forward from here on out. The executive committee and I have hired Doug Ma to assist us in this kind of a strategic planning light phase as we look to how can we implement some changes, what does that look like, how do we utilize best practices going forward. One of those big goals that we're working on is going to be how do we identify some community level measures that we can implement as an initiative and really start to monitor, with the ultimate goal of bolstering our support to our teams. When you look at Thurston Thrives, it's not just about meetings or whatever it may be, it's really about how can we magnify the impact of our organizations that are at the table within those teams so that their work is even more influential and even more beneficial to the community. One of the amazing things about working within Thurston Thrives is the partnership with the Public Health Department. So any of the work we have going forward is going to be deeply rooted within the community health equity community health assessment that is going on at Public Health right now. So thank you to Marianne O'Gara, who's already left, for all the work that she's doing there, because that's really going to help us make data-informed decisions about what we can be monitoring and actively looking towards, as well as how can we really start looking at what is our role in the community as leaders, as stakeholders, and as partners. One of the things that you'll see in front of you is a little brochure. It's one of the first of many little projects that I'm undertaking at the moment. What I've realized when looking at Thurston Thrives is a lot of times people don't know what it is. What does it mean to be part of Thurston Thrives? What are the outcomes and things like that? That brochure isn't going to answer all of those questions, but it is a tiny piece in the bigger puzzle looking at how to start pulling out outcomes and measures of the teams and give things that bring awareness to Thurston Thrives as an initiative in our community that is deeply rooted in public health and improving our community. So thank you, commissioners, for being so supportive of this initiative for the past 6 years. And thank you for Public Health for all the support, because what's really amazing about the teams is a lot of them are very supported by the Public Health Department. So we know that we are learning from best practices in the community as teams meet. The organizations that come to those team meetings know that they're able to learn from their government at the same time, which I think is a really unique partnership. And it's started to incentivize other jurisdictions to participate as well, which I think is very beneficial. If you look at, for example, the Housing Action Team, we've started to have monthly updates from all of the jurisdictions on things that are happening within the community. So really creating a platform for cross-region, cross-sector conversation and collaboration around issues that are really important in our community. And just one more thing I wanted to point out, that sometimes people say, well, who's actually part of Thurston Thrives? kind of the basic analysis I've done in the last couple of weeks, we have more than 80 individual organizations partnering on a monthly basis within the action teams, which is over 150 people on a monthly basis at our meeting. And so that's within not just the action teams themselves, but a lot of the teams have formed working groups as well underneath it, so subgroups. And that's just kind of basically looking at the attendance rosters of people. And that's not even the mailing list, so this is touching and actually learning from the teams at the same time. That's kind of a high level of where we're at. I just wanted to say thank you because a lot of the work will be rooted in how can we increase our impact, how can we support the teams better, and how can we make sure that the work that you all have been doing, you know, Commissioner Hutchings chairs the Partners for Children, Youth, and Families. Obviously, Commissioner Menser attends Coordinating Council and is part of the conversation going forward. So thank you both for that very much.
You're welcome.
Always available for questions.
Questions? Keep up the good work.
Thanks.
We're all in this together, right?
Yeah.
And I enjoy sharing that, the partners, working with all those other, the partner agencies,
Yeah.
and Youth Alive too.
Yeah, I'm learning a lot from that as well.
Scott Hanauer, beautiful.
Catching myself up there.
And QPR,
Yep.
in preventing suicide. Question, persuade, and refer. Yeah, good stuff.
Yeah. Good.
I've been working, I had scheduled conflicts, but the last 6 months or so, I've been participating in the Environment and Climate Change Group. So
Oh, nice.
that's been interesting because we've been trying to coordinate our work with the efforts of the Climate Mitigation Steering Committee and seeing where we could maybe fill gaps in work that's being done there at that level. And then last month, we talked about, okay, as that work gets more and more focused, do we then step back and take a bigger environmental, because they've really been focused on climate, but there's a lot of other environmental issues that could potentially be addressed by that group.
Nice.
So
Great. Yeah, one of the things I'll be looking at is what are the teams actually working on and be able to start broadcasting that to the community. Because I think people say, well, what projects are they doing? What impacts have they had? So I'm really looking to categorize that. So I'll be able to show this is what the environment team is working on. This is what the housing team is working on, and really start getting people engaged. Like, oh, I want to work on that. How can I do it? And letting people know better. So thank you for that.
okay, thank you, Crosby.
Thanks.
Thank you, Crosby.
All right, that takes us to
Congratulations. Sorry. Go ahead.
yes, good to have you back. The next item is 8, resolution regarding appointment of temporary health officer. I'm going to turn back to Shelley to kind of frame this particular.
Yes, thank you, Commissioner Menzer. As you will recall, last month at the Board of Health, you amended a previous resolution that you made in November of 2019, appointing interim health officers to support Thurston County. Part of what was amended last month was including our health officers, Dr. Kathy Lofi, and her designee, who has been Dr. Scott Lindquist. These are the state health officers, and they have very kindly and graciously been acting as Thurston County's health officers for communicable disease matters, including the response to COVID-19. When they agreed to support Thurston County as our local health officer representatives, we did not have COVID-19 at that time. Dr. Lofi and Dr. Lindquist have been very busy at the state level, and we're very grateful for their leadership and the guidance that they have been giving to all the local health jurisdictions statewide. But we needed to give them some relief given the situation we're at with COVID-19. So today, I'm requesting that you amend Resolution H1 2020 with Resolution H2 2020, which will replace Dr. Kathy Lofi with Dr. Diana Yu. As you know, and people in our viewing audience may know, Dr. Diana Yu was the Thurston County Health Officer for many years, and she has been retired and enjoying her life and has very graciously offered to come back to support Thurston County on a temporary basis as a temporary employee while we continue to recruit for a permanent health officer. We expect to have a permanent health officer on board in the next month or two, but at this time, we would love to have the opportunity to receive support from Dr. Diana Yu. We can offer her a temporary employment position, but as the Board of Health, you have the authority to appoint all health officers. So we would like to maintain the other health officers that have been supporting Thurston County and replace Dr. Kathy Lofi with Dr. Diana Yu. Any questions?
Questions? Yeah, how about Commissioner Hutchings?
I have a couple questions. Number one, you said you're asking us to amend Resolution 81-2020, but I don't see that in here. And this calls for is that
Back of your packet.
on the very, very back of the packet? Okay.
There's
But
a
I'm looking at the motion. It says approve a resolution. Should we have the number in there then?
yes, the motion that we are requesting you to make is to approve Resolution H2 2020. And the very first paragraph of this
2020.
resolution is this is a resolution amending Resolution H1 2020, appointing interim health officers for Thurston County until the appointment of a new permanent health officer and replacing Dr. Kathy Lofi with Dr. Diana Yu.
I think what Commissioner is asking is whether the action should be revised to reflect resolution number H02-2020. Is that,
Yes. Yeah.
so you may consider introducing an amendment to the action?
I mean, just a specific reference to the resolution. Okay.
H02-2020. Okay, so that's going to
Is that
be,
really an amendment? I mean,
I don't know if we need to do that.
Well, just to, is,
it makes the motion with that specific information. I think
Okay.
it's okay. It's not anything different.
I have no other questions, no. I was looking at the procedure and the process, making sure we're doing it right.
Okay. Okay, then I would entertain a motion if the board.
I move to approve a resolution for the appointment of a temporary health officer to focus on COVID-19, Resolution H-02-2020.
Second.
Okay, it's been moved, it's been seconded. Any other discussion regarding this item?
Correct?
no, it's fine. I
Or
think.
do we need to do an amendment?
No, it's that you have two resolution words on the same action, so.
My apologies. Legal did review this and prepare this resolution as written for us. That gives you any.
Suggestion?
Yes,
I
please.
think the motion is to move to approve a resolution,
H2.
H2.
well, for COVID-19, comma.
Called.
Resolution. I mean, I think it's okay.
I think that as
We've
I
added.
remember I said that. I added that at the end.
Reference.
Okay.
Moved, seconded. Any further discussion?
No, sir.
No, sir.
All in favor, say aye.
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 That motion carries, and we have adopted Resolution H02 2020. And it's now the point where the Board of Health members discuss any health-related activities they'd like to share with each other, the public. Anything you want to report on, Commissioner?
I guess it's going to be very similar to the meeting today. I would add one thing to it. My week, since the past meeting, has been biosolids, on-site septic, water quality, and veterans issues. That's it.
I would say water, veterans issues, and aside from the typical normal updates on COVID-19, because it's changing rapidly, we all attended a 1-hour State Department of Health webinar on this. And we're also working on another health issue, and that's a vaping in public resolution.
That's right. Those are two things I had on my list as well. We have had multiple briefings on COVID-19, including that State sponsored webinar, which was useful, the vaping ordinance, and then I attended, of course, I missed opioid task force, I believe, this month, but Thurston Thrives Coordinating Council meeting was focused on substance use disorders in youth. Kind of new statistics from Jason Kilmer of University of Washington regarding marijuana use and substance use and how that connects to some of our other health indices. And the big takeaway for me from that was just I'd heard it vaguely that, marijuana potency had increased substantially since the 70s and 80s, but he had more specific hard data on that. And it really has increased 10, 20 times
Oh, yeah.
the potency, which I think changes the equation to some degree on some of these issues. It's something I think the state ought to look at in terms of the way we handle our marijuana industry. So that was that. And anything else for good of the order?
No, sir.
Board of Health?
No, sir.
4:55, we are adjourned.
Thank you.